A healthy mind is a prerequisite for the physical, social, and spiritual health in life. Fact also prevails that 1 in 5 persons is mentally unwell and suffers from one diagnosable mental disorder or more. Helping such a huge segment of population with a handful of psychiatrists and other mental health professionals is nearly an impossible task. It can be made possible only with community-based mental health initiatives with an extensive community involvement and empowerment. Guided with this very view and vision, Nishkam Foundation embarked on a journey on 15th January 2011, launching community mental health campaign in Sangaria block of Hanumangarh district in Rajasthan. Since then, the initiative has reached to a large number of people with mental health and drug abuse problems, connected with them, engaged with them, and touched their lives seamlessly. We know that today at every layer and aspect of our social setup, mentally challenged people, people going through depression, people suffering from severe mental disorders, people submerged in drug addiction, or even disconsolate ones are stigmatized, discriminated, isolated, and even ostracized completely. But we have picked up the gauntlet to awaken the society and spread awareness about mental disarray so that people with mental health problems are identified and treated properly and get back to their deserved place in the social order. Started as an offshoot of Humphrey Allumni Impact Award and conceived by one of its recipients, Dr Dhanesh Kumar Gupta, the campaign has turned into a well-thought crusade now. Our campaign, thanks to the society's participation at the very nub, is intrinsically comprehensive and holistic in its concept. Mental health awareness among the masses, capacity building of local healthcare system, and availability of treatment facilities at the doorstep are the three major components which complement each other for the overall goal of the campaign, which aims removal of stigma and reduction of treatment gap for the mental illness. Right from the inception, regular free of cost mental health consultation camps organized every month in Sangaria are a definite part of our curriculum. Qualified doctors from Bikaner, Sri Ganganagar, and even Singapore have been providing treatment to mentally ill in these camps and have healed hundreds of patients. Various mental health awareness activities are conducted recurrently. We organized Nishkam Mental Health Awareness Week in Sangaria in October 2011, which saw an active participation of local schools, organizations, and representatives on a big scale. Our campaign reached to the interiors of nearby villages, first time in the area. Mental health exhibitions were organized in 27 schools, 10 hamlets, and at 4 festive occasions. Man Ke Darpan Mein, a film on mental fitness, was shown to about 10,000 strong audiences in these exhibitions. Painting competitions on mental health and drug abuse related issues in different schools of the area were an instant hit among the students. Mental health rallies were organized in not less than 16 villages. Awareness activities have been continuing regularly since 2011. Training and capacity building efforts encompass making local healthcare providers and community leaders learn symptoms of mental disorder, necessity of treatment, and need to have positive attitude towards the affected patients. We often make arrangements to have doctors of Sangaria trained in diagnosis and treatment of mental illnesses. We have had 13 sessions for these doctors with the collaboration of the local branch of the IMA. Dentists are advised to propagate deleterious consequences of tobacco consumption. Nursing staff and community health workers of the area are taught to pick the symptoms of the disease and refer the patients. We have had 6 sessions with them. We have regular interaction with Gram Panchayat and local representatives on the concern, and thus far we have had 3 sessions with them. We have time and again organized symposiums in collaboration with different charitable organizations of the area and explored the possibility of collective effort to garner resources for the movement. We have also taken chemists of Sangaria on board with us. We have had 4 sessions with them to encourage good dispensing practices. As a first systematic effort in a rural area in the private sector, the chemists in Sangaria dispense the medicines to the mentally ill patients in separate printed envelopes with the proper dosage and instructions written over them. Not only that, they also explain the requisite information to the patients and their caretakers. During our campaign, we came across an extremely painful and soul-stirring reality. Many of mentally unwell patients were still chained or locked in their houses by the ignorant, helpless families, probably as the last and convenient resort, carrying on with the remnant of old practice in the area. We started a program, namely Mukti, in February 2014 to liberate and rehabilitate these mentally ill people. Launched by Shri Rajendra Singh Rathore, Honorable Minister of Health in Rajasthan State Government, as a district-wide program in Hanumangarh, Mukti has been a successful human effort. We have come across 40 such patients till January 2015, and 13 of them have been released while others are on the path of recovery. Many of our patients in Mukti program are from the adjoining areas of Hanumangarh. Soon, we are planning to extend the program systematically to entire Bikaner division in Rajasthan. All in all, we are trying to bring about a system transformation in Sangaria and adjoining areas where every mentally ill person and drug addict is provided with proper medical treatment and help to come out of the disease. Community mental health campaign is on the way. We have charted a course for ourselves to take social service into a different level. We are gaining momentum. We have a brigade of 50 competent and experienced volunteers right now who are fiercely committed to the cause. We know there are lots of places like Sangaria, but we have taken a small step towards the big destination. Let's make ourselves committed to make this world a better place for everyone, including the mentally ill.